Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. This is a very short lecture about risk assessment tool for venous thromboembolism in pregnancy, and of course, postpartum also. Why risk assessment? To give thromboprophylaxis. Okay? So we need a simple tool to evaluate the risk factors for any pregnant lady. Okay? Okay. Let us start with the time of risk assessment for venous thromboembolism. At first booking visit, yes. Then at every antenatal admission, yes. With current COVID-19 infection, yes, of course. So, what is the component of this risk assessment tool? Three components, okay? Pre-existing risk factors, medical comorbidities, transient risk factors, okay? After we finish all these three important items, we found the lady carry three or more risk factors, she needs thromboprophylaxis with low molecular weight heparin, for example. Okay? But let us explain the pre-existing risk factor, the medical comorbidities, the transient risk factors. Let us start with the pre-existing risk factor. Family history with venous thromboembolism. Body mass index more than 30. Parity more than 3. So multipara. Smoking. Maternal age more than 35. Then we do mark or tag here with each item, okay, till the end of this risk assessment tool. Okay? Okay. What about comorbidities? Medical comorbidities, including nephrotic syndrome, varicose vein, paraplegia, intravenous drug user, hematological problems like sickle cell anemia, polycythemia, thrombocythemia, myeloproliferative disease, inflammatory bowel disease, systemic lupus, the active one, or other relevant risk factors. If any of these are positive, we put mark here. Okay? Let us go to the transient risk factors. What are the transient risk factors? Like hospital admission, like current COVID-19 infection, like immobility, woman with bed rest more than 4 days is considered risk factor. Surgery during pregnancy or immediately after delivery for any reason. Cesarean section, instrumental delivery, excessive blood loss more than 1 liter, blood transfusion, preeclampsia. All these are transient risk factor. Any one of them positive, we put mark on this side. Okay? Let us go to complete the transient risk factor. Systemic infection, multiple pregnancy, assisted reproduction, hyperemesis gravidarum, dehydration, postpartum wound infection. So this table and the table before under the heading of transient risk factor. Any one of them positive, you put mark in the table like this. Okay? Now, after we finish This assessment tool with the three components: the pre-existing risk factor, the comorbidity, medical disease, or transient risk factor. And I set the item below each heading. And we give tick or sign or mark for each item. At the end of this assessment, women with 3 or more of the previous risk factors, we should consider low molecular weight heparin for thromboprophylaxis, like Lexal, like Noxaparin, and so on. Okay? So, 3 or more of the previous risk factor indicate low molecular weight heparin thromboprophylaxis. But you should know that if the woman has a personal history of venous thromboembolism, immediately should start low molecular weight heparin thromboprophylaxis. Okay? Okay. This is the end of my very short lecture. I hope it is clear enough. This is my book published on Amazon, textbook of obstetrics, textbook of gynecology, contraception handbook, and the multiple choice question book. This is my site on Amazon, and this is my site on YouTube and my site on Blogspot. Thank you, everybody.